Hey everybody, it's Ed O'Keefe, and welcome to another episode of America's Leading Experts. I'm here with Dr. Brian Ellefsen of Missouri Valley Sports Medicine Orthopedics. Did I get that right?
You did, sir.
And RegenX.
RegenX, yes, sir.
Yeah, so I'm so excited to have you here because you're on the cutting edge of you're like in the combination of orthopedic surgery meets regenerative medicine. You're on the forefront of the whole thing, and I think it's amazing. And so I'm excited to have you here. Welcome to the show.
Thank you. Good to be here.
Yeah. So why don't we just tell everybody briefly before we get into regenerative medicine and how it's helping people recover faster than ever, and how'd you get into what you're doing now, and what excites you about
it? With the orthopedics,
yeah,
just didn't make it to the next level to play. Looked like a good alternative to getting orthopedics.
Where'd you play football?
Played football, right?
Yeah.
And then saw that team doctor's pretty involved.
Yeah.
Makes all the meetings, gets to travel.
Yeah.
So it was kind of my interest. And practice primarily sports medicine, taking care of collegiate athletes and above, some high school athletes, premier athletes, but primarily college above. And part of the problem we had was some of these injuries that they were receiving were either partial tears,
yeah,
or they were chronic nagging type things, hamstring pulls, those kind of things, and looking for some way to treat them besides waiting for the tear to complete or rehabbing them and being out of play for a whole year. So that's kind of how I got into the cellular medicine. Started out with PRP and then worked way up. So over the last 15 years. And now we've got endless options to treat, from stem cells to exosomes. Still PRP still has its place. But the level of concentration of the delivery is just so much higher.
Yeah.
So we can inject somebody with a partial ACL tear, partial labral tear, partial rotator cuff tear, even with a cartilage injury, and get them back playing quicker.
Without surgery?
Without surgery.
Yeah.
And then in addition, post-operatively using it.
Yeah.
About 2 weeks out would use it. I've done it long enough that some of my athletes that I previously had done, let's say, ACL surgery on in their 20s, I've been at this long enough, they're in their 50s. And they're saying, hey, doc, what about us? What can this cellular medicine work for us? Initially, really didn't have much of an answer for them if they had.
Now that they're in their 50s.
Correct. Yeah, having arthritis as a result of traumatic arthritis. Found it was very successful for them. A little bit different techniques sometimes, the delivery. Started getting more into backs, necks. Obviously, with high impact sports, that comes to rest later in their lives and bother them. And pretty successful in that. So now it's a spectrum of patients that we see. And more so the older population coming in with their, I think part of it's a distrust of the system, but a lot of it is, I'm at an age I don't really want to have surgery. I don't want to go through the risks of having surgery. What are some alternatives? And we're finding out that we can give them a much better quality of life without having to do surgery.
Yeah. So it's kind of cool. You get to see a spectrum of all ages and conditions.
Correct.
It's like a full circle, environment, which I think is pretty amazing. So how are so let's just, I want to back up just for a second. So on the 50 and above, 60, 70, people with injuries, America's been great at just putting people on medications,
right?
Cortisone shots, and it's a glide path to surgery. And I think they're waking up to the idea, one of the reasons why we have this show is they're waking up to the idea that that's not always the only alternative, and at least they have options. And so is that how patients are finding you now, to be like, I was told I have these issues, I may need surgery, I'm looking for alternatives before they come into your clinics, whether it's for their knees, hips, shoulders, ankles?
Well, my patients come into the clinic, and we give them an option if they're a candidate to have it from the get-go.
Oh, is that right?
Up front. I've been doing it long enough. I think that most of mine's word of mouth.
Yeah.
New into this social media type thing for me.
That's okay.
And got a real good person that's helping me through that with AI.
Yeah.
So our websites are interactive, chat bots. People can get on and ask more questions. having more hits.
Yep.
And I think then they could get answers. I think the internet's just full of opinions. Many of them are nothing more than that without fact. And so it's very confusing. And I think it's sometimes hard for your older patients to navigate. But one thing I do know is that they communicate. So if you can, the first few patients that we had that were successful, them telling friends at whatever gathering they had, so this thing just grew exponentially from that.
Yeah. Yeah. Well, people have questions. They're naturally skeptical, especially if they've been suffering with pain, because they've tried a lot of things and a lot of things just don't work, you know.
When spent money on TV advertisements, things like that.
That's right.
The other thing in my clinic is, for myself, most of the things that I do, I've had done myself. My family's had it done, my mother. So I think being able to speak with somebody and give them examples of family members who I would treat and in the same manner kind of makes the conversation better. And then you can also lead them to better places to get information they need.
Yeah. Do you mind sharing an example or two of whether it's a family member or someone close to you? You don't have to just share their names, obviously, of pre-treatment and post?
Well, probably two of them. One was my son, had a avulsion, a tibial apophysis avulsion, so his patella tendon hooking into his tibia. He had the type 3, pretty severe. So we did surgery on him to fix it, and then treated him post-operatively. That's an example of post-op use. And he was back before the season was over playing, which is pretty much unheard of now. Pretty incredible.
Oh my God.
With serial radiographs to see and MRI before and after to show the healing. So my own son, and then my mom, which she is now the Uber of the 55 and over neighborhood. She's 83, had trouble getting around her own home. She's in a gated community, her own place and everything, very active. But they told her that's the only thing you have. We can give you total knees, and that's all we can do. We have nothing else to offer you. And so we stem celled her knees. And she's probably 4 years out now. And like I said, she's the shuttle. She's the queen. She gets everything organized. She's up and around.
Is that right?
Yeah, doing everything. So
did she ever have total knees?
Did not.
Okay, so I just want to make sure. So she was told the only thing, this is so powerful, the only thing we can do for you is do total knee replacements.
Correct.
And do you mind sharing a little bit about what was her symptoms and condition at that time?
Well, she was having trouble just getting out of the chair.
Just getting out
anything
of the chair.
low. So we had elevated all our chairs. We got her lift chairs.
Yep.
Even in her vehicle, allowed that to be lifted higher, so she had to step up, so she didn't have to bend so far.
Because she's stuck.
She couldn't squat down. Had to have a grasper to pick things up off the floor, and even had to bring in handicapped stools for her to sit in the bathroom. So
which is then she was a high threat of falling.
Oh, absolutely, absolutely. And she wants to be busy, so then you're not picking your feet up enough, and then you're catching your toe and falling. Right. She had a couple falls. Yeah. But like I said, now she's the organizer. She's the one that goes picks everybody up, and she makes sure everybody else is doing okay, even though she's the older. She's the one that's watching everybody. Yeah. So worked out very well for her. And we know stories like that when you're talking to your patients, your own mom. You hope it works out for your mom. Yeah. Right? But worked out well.
Good experiment, Mom.
Mom was
can you explain why did that work so well? So what is going on with stem cells that people ought to know that you're able to take joints that are so beat up and degenerated, and the old medical methodology is just, it's like bringing a horse and buggy when you have a train. We're maybe not that dramatic.
Well, I think part of the problem is with the training is if all you have is a hammer, everything's a nail.
Yep, that's right.
So that's it. That's all. That's all you got. And I think the other thing is understanding what the pain generator is. The belief I still hear is that if it's bone on bone, we can't treat it. Well, I see many of the farmers where I'm at in mid America, mid Missouri, are bow-legged because they've been up and down equipment, but they don't come in for knee pain. They come in because a cow kicked them and they want an x-ray of their tibia or whatever, make sure it doesn't broke, and their knees are wore out, but they don't hurt. So, and they're bone on bone though. So
That's so
what's the
interesting.
pain generator? Well, I think a lot of it is the inflammatory response they're having. It's the soft tissues, the capsule, maybe the ligament structures that are now more stressed because of the deformities.
Yep.
And many times, at least a good portion of their pain is soft tissue in nature. That responds very well to cellular medicine.
There you go.
We've got the anti-inflammatory properties of what we're using, but also the growth factors. So we can rejuvenate that soft tissue and alleviate their pain. The other thing is the process of injecting. A lot of it's capsular pain. So the water balloon that makes up the joint that holds everything in place gets contracted because it's inflamed, because your body doesn't want you moving that painful joint. And then when you move it, the capsule ends up being part of the problem for your motion. Part of that process of putting the cellular medicine in place is you distend that capsule XYZ plane. That can't be done in therapy. You can do flexion, you can do extension, you rotate. You can't do them all at once. And with that distension, lasts about 2.5 hours. When that distension resolves, you've got capsular laxity, which now you're not loading the joint mechanically before you even start. You've got normal movement through the capsule. And I think a lot of your pain's capsular with degenerative changes.
Is that right? Wow. Wow. So, so that this is where we're going with Is it Regenex? Is that,
Regenex, yeah.
Yeah, that's amazing.
Yeah, we do, but even small joints in the hand, knees. Obviously, we see more knees, hips, shoulders, that type of thing. But cervical spine, thoracic, lumbar spines a lot. I see a lot of post-operative backs. When these older patients that have fusions, it's their sacroiliac joints that are painful.
Yeah.
Well, then, the standard issues that let's just fuse those two. Well, then they have no motion, and so you can inject SI joints. So there's a lot of, tendinous, partial tears, rotator cuff pathology in older patients.
Yeah.
Very successful.
Yeah. So I would imagine are you seeing more now that pickleball is such a big sport?
Without question.
Like, I mean, there's like, I think some statistics said there like 77% of people playing pickleball are injured while playing pickleball.
Yeah.
So,
and not just, a lot of fractures from the falls,
is it?
but you see a lot of,
You're kidding.
you see a lot of rotator cuff things,
wow.
knee injuries, ankle, foot's a lot of it because they got arthritis in their feet. Now they're banging on the
cement.
Yeah,
Yeah,
correct.
the
On
hard,
the courts.
hard
Yeah, right.
concrete. Yeah, yeah. And then, but what I was going to say there was like with pickleball, golf, tennis, all those things like that, people have such a strong identity that's part of their makeup of who they are. And so when we take that away from them completely, a lot more is lost than just.
Well, they don't have their work that was part of their life too. A lot of these people are retired, so that is their
That's their
day-to-day,
identity.
right?
Yeah,
Sure.
that's great. Yeah, so you're doing a great job of getting them back out there. Let's see. What question should I ask you about? What do you get asked a lot when people come into see you as far as like what either their pain they're feeling, their symptoms they're having, or yeah, I'll open it, keep it open ended.
Well, I think a lot of them have the misconceptions, the fountain of youth.
Mm.
If you come to my office and you are in your 60s, you want to make the U.S. gymnastics team this spring, I probably can't help you. Right?
That's right.
So you got realistic outcomes.
Yeah.
If you want
What's
to be
the
able to
role?
mow the lawn, you want to be able to golf.
Yeah.
In my part of the country, guys are still farming, working cattle and climbing out of equipment. They want to be able to do that. They want to deer hunt, climb up in a stand.
Yep.
Those kind of things. I think those are realistic expectations. So a lot of the questions are, is this a cure? Well, it's not a cure,
Yeah.
but it certainly does help with symptoms of the degenerative process of aging.
That's right. That's right. That's fantastic. And so where are you located at?
My main office in Sedalia, Missouri, is the center of the state.
Okay.
We do have some outreach clinics that we go to, especially for some of our patients that are older and can't make it in.
Yeah.
With Sedalia being where it's at, we have quite a few of our patients that will fly in from outlying areas. And so it's a, hour, a half to 2 hour drive to get to the office. And then, most of them can be in and out in the same day.
Yeah. That's pretty amazing. Are you seeing a lot of athletes now still?
I still see a lot of athletes.
Yeah.
That's probably the lion's share of my treatment as a whole for orthopedics. But we're seeing as many retirement age patients, so I'm going to say 50, 55 and over, as we are seeing athletes. And before it was predominantly just athletes.
Oh, wow. Yeah. Well, I consider that that's a great thing, that as people get older, they now have options, and we didn't have those 10 years ago,
No,
15
I
years
think
ago.
the learning curves made a difference. I think the thought process was if you have degeneration, it's not going to help you, right? You've got to have cartilage left.
Yep.
And that's just not true.
Yeah.
You can see some pretty significant degenerative changes that get considerably better sometimes even before they leave the office.
Yeah, yeah. All right, so I'm going to put you on the spot then before we let you go for today. Like, what's another one or two favorite patient stories that makes you proud, and that you went into this profession and you're staying on the cutting edge?
Well, I think recovery rates. So had an athlete that was a pitcher that had internal impingement. So he had a slap tear, which is a labral tear, and a cuff tear. And we repaired those, and 2 weeks later, then stem celled him. And his progression rate to return to throwing motion was cut more than in half, and then actually throwing light was real early. And he had been seen at one of the bigger clinics down in the Grapefruit League where he played and hurt his knee. And they were doing a follow-up, and he said his knee was doing fine, but he recently had this shoulder, and they were asking him questions about his shoulder, and he was telling him how far out he was, and he was throwing, and they said, "Oh, no, you can't throw, that won't work." Well, he was already past that stage, right? So we're excelling in recoveries, ACLs, which is a pretty common procedure I do, meniscal repairs, as I said, shoulder, labral, and cuff repairs tremendously.
Yeah.
And then I have a lady that we took care of, is in her 50s, undiagnosed type, but multi-joint involvement in her hands, almost to dysfunctional levels. Having to hold a can to drink out of
With two hands.
such, yeah.
Yeah.
And was told all they could do for her pain was to give her meds or fuse her joints.
Is that right?
We ended up injecting each individual joint and increased her range of motion dramatically to functional levels.
Yeah.
Again, there's nothing else you can do. The standard in the industry for hand specialists was, we really can't replace all those joints. We're gonna have to fuse you, maybe try to leave some functional, but not giving her much hope.
Yeah.
And the beauty of the cellular medicine is, if it doesn't work, we burn no bridges. You can always do surgery. You never can undo it.
We're like fusing spines together, and doing that, you're kind of crossing your finger that.
Well, and you're perpetuating the problem because
Yeah.
you're fusing levels that work in functionally together. They're not individual units. They work as a team. If you take three or four players out of the team, the other guys have to play harder.
Yep.
So you're
only a
going
matter
to
of time.
have
Yeah.
you're going to have more levels of fusion. You're coming back. They're going to see you again.
Yeah. Yeah, that's crazy, man. That is crazy. That's crazy that it's not just like, this should be like at the next medical conference, like mandated that you all need to start treating people with regenerative medicine. And,
There's some early stuff coming,
yeah.
but I think the basis for everybody is they want to have, white paper studies that have shown you 10-year, 15-year results. Well, by the time you show those, you're 25 years out.
That's right.
Right. And now's now.
Yeah.
And so it's early, but you still have the professional skepticism in the orthopedics is still pretty high.
Yeah. I wanted to make the analogy of like my son's in finance and entrepreneurship in college right now, but no one lets him use AI. And I'm like, dude, do you know, like outside of in real world, we use AI for everything?
Yeah, right.
And so, it's crazy. Totally different topic. Well, great. So if there's people out there, they'd like to come learn more about you, they can look you up at Missouri Valley Sports Medicine Orthopedics. And RegenX, does RegenX have a website
Yep,
yet?
sure does.
Okay, is it regenx.com?
RegenX, yep.
Okay, cool. And then we'll have it somewhere here below the video or on the screen. But well, it's great meeting you, Brian. Is there anything else you want to say to the audience before we head out, as far as what you'd like them to know about cellular medicine or any kind of recovery?
I think like anything else, do your research. If your research is only on the internet, it probably needs to be reviewed with somebody who has some experience in it, can kind of clear things up. It may be something you decide is not for you. Obviously, then you're in the mainstream and you proceed how you must. But also know that if you decide to have the total joint replacement, I still see those post-op and do cellular medicine, get rid of their pain.
Yeah.
So, risks, benefits, weigh those out. I think you'll find the risk factor for cellular medicine is nearly zero.
Yeah.
The benefits can be tremendous. And it's certainly something that, if nothing else, can buy you some time before you have a definitive procedure.
Yeah. That's great. That's great. Well, thanks for being on the show.
Appreciate you having me.
Yeah, fantastic. Thanks for watching, everybody, and we hope to see you on the next episode.